Welcome back to Doc Saying Stuff. I remember in college, I started not to be able to see far away. I wanted to know why. We got a lot of questions on ophthalmology in general, so let's bring in our expert, Dr. Rupa Wong.
The most common cause of nearsightedness is axial myopia, when the eyeball is just a little too long. We can actually measure how long the eyeball is, and what's happening is that the image that's getting transferred, all the light rays, is focusing in front of the retina instead of on the retina because the eyeball's too long. So the top 3 symptoms of myopia or nearsightedness: first one, blurry vision, especially for distance objects. In addition, you might notice that you need to squint, and when you do squint, it helps the vision. The reason for that is you're decreasing the aperture, the amount of light that's entering your eye, and it helps bend it in a certain way that focuses it on the retina. And then the third symptom is eye strain. All that squinting, all that blurry vision can cause a lot of eye strain. So there are a couple different surgical options for nearsightedness. Most people know about LASIK, which is the laser that cuts the cornea and then applies the laser, and then you put the flap back down. There's also PRK, photorefractive keratectomy, which is very similar to LASIK, except we don't use a laser to cut the flap of the cornea. We just abrade the corneal epithelium down and then apply the lasers. And then there are 2 newer options actually for people with nearsightedness. One is called SMILE, which is small incision lenticular extraction, and they remove and reshape the cornea by just removing little pieces of it. So it's a little bit different than LASIK, and it allows the cornea to change shape so that the light is focused on the retina the way it should be. Another one is a surgical procedure in which it's called implantable Collamer lens, in which this special lens is put in your eye behind the iris, which is the colored part of your eye, but in front of the lens.
Thank you for tuning in to Doctor Saying Stuff, the place where we do a deep dive into common medical questions like, what is nearsightedness? So like, subscribe, comment, share, do all the things, and we will see you next time.